I'm Tim Smith. I work at Lakewood Family Medicine. We have 11 doctors and 5 nurse practitioners. We see about 250 patients a day, and we have about 28,000 active charts. We started using Isabel approximately 2.5 years ago, and have found it to be incredibly useful for patients walking in the office with signs or symptoms that don't, actually add up, and it's a simple matter of putting those signs and symptoms in the interface and generating a differential diagnosis list that you normally may not have thought of. When you're in primary care or family medicine, you're just dealing with a myriad of possibilities for diagnosis.
I tend to use Isabel under a couple different scenarios. If a patient's coming back and the things that came to mind the first time and we kind of worked up didn't go anywhere. We still don't know what's going on. The patient's not getting better. Maybe they've got a few new concerns or complaints to add into the mix, but they're not clearly fitting into a common diagnostic profile. I'll use it to prompt a broader diagnosis list, the differential list, to see if there's something that I should include in that initial workup that maybe I wouldn't otherwise.
Probably one of the more notable cases was a young man who now at age 18 was diagnosed with ankylosing spondylitis when he was 14, and he had undergone some very expensive treatments over the years and just never did very well. He always never really seemed to respond to the treatments. The treatment for ankylosing spondylitis frequently involves the use of Humira, and Humira costs alone at about $18,000 a year, not to mention the costs of the laboratory testing that's involved and the specialist. And so it's a sizable cost, and this went on for a number of years. After getting Isabel, I just ran his symptoms through the signs and symptoms through the interface, and what kind of popped up at the top of the list was Lyme disease. About 3 weeks into treatment, he presented to the office and he had a rather marked rash that's now known as erythema migrans, and he felt poorly. And but the physician who saw him at the time said, stay on your antibiotics. I really don't understand what's going on here, and come back next week and see Dr. Smith. And so when he presented to in the room, the most curious thing was his dad said to me, he says, he doesn't look very good, but tell Dr. Smith what you've been doing. So this kid, for the first time in 4 years, bicycled 6 miles. I mean, just this incredible thing. I mean, he couldn't do anything like this. He was in constant pain. And 6 weeks after treatment, he bicycled 50 miles. So this kid is absolutely 100%. And I got a call from his physical medicine and rehabilitation specialist at Mary Freebed. And he just said, I don't need to see this kid anymore. He's cured. So that was a very interesting moment for us.
There was one gentleman, he was in his 50s, fairly overweight, was coming in with what he was complaining of as left-sided chest pain. And he said it was just a deep, deep chest pain. The obvious diagnosis was to start with a cardiac workup, which we did, and the cardiac workup was negative. We just didn't come up with anything there. So then we treated it for musculoskeletal. I think at this point he has seen 2 or 3 different providers. I saw him after that original workup. Thought, wow, everything I would have done has already been done, and there's nothing there. What else is there? And so we plugged all the information in to Isabel, and one of the things that came up in the differential diagnosis was a gastric tumor, stomach cancer, and that's what it ended up being. Nothing that I thought of. He wasn't complaining of any digestive symptoms. hadn't had a change in bowel, wasn't complaining of reflux or heartburn, the things that would lead you to think about a gastric cancer, but just had this deep pain that wasn't resolved with any of our other treatments. So that one's a very clear case that he had seen several different providers, had gone through a pretty extensive workup, and was almost told, you know, we just don't know. You know, it's probably musculoskeletal. Let's put you on more anti-inflammatories. But it was Isabel that said, you know, don't miss that gastric cancer.
We use Isabel for those cases that we really have some questions about, generating a differential diagnosis. The cases that are frankly a little bit different when patients present and not every sign or symptom lines up.
For the ones you just don't want to call fibromyalgia, you don't want to call malinger, you know, chronic fatigue, you want to make sure you're not missing anything, you know, that's kind of the case that gets plugged in. We
just put that information in the interface, the positive signs and symptoms, and generate a differential diagnosis.
When you pick up that cancer you would have missed, that changes someone's life.